So the third row usually would be at the corner of the mouth. This almost goes up to the orbital rim. So if you wanted to go higher for a lift here, then you use the shorter threads and start a little bit higher. So it's very flexible according to how you want to design it. The reason why I've kept it a little bit lower in her is because I don't want it to really curve over here. The skin is quite good, so the needle sometimes just have to be very slow tunneling it through. You alright?
Mm-hmm.
Is it more sore up here or about the same?
About the same.
That's good. So you can take it out if it's easier for you to place the needle. I'm just showing it for demonstration purposes. Yeah. And it also helps with hemostasis, so they tend to bleed less if you leave it in longer. Just a physical hindrance. And while everything is in there, this is just the right depth to be injecting PRP. So if you wanted to inject PRP, you could. You just have to remember to flush it in with some normal saline afterwards because it stays in the hub.
Yeah.
Still okay?
A little bit ouchy, but last one.
Are they all the same length that you're using?
Yeah, it's easier to order all the same length just for convenience. You can get the shorter ones if you find that there's specific smaller areas you want to target. So these are 38 millimeters for the needle, 50 millimeters for the thread.
So if Nikki was training, she'd be using the 50 mil length.
That's the most common. Any longer, it will be hard to get around curves. And shorter ones, some people like it to open up the nasolabial folds and just put a lot in. Because if it's really long, the ones with the really deep nasolabial folds, the depth is not consistent. You'd be in fat. And then more, subdermal is actually superficial subcutaneous anyway. But you don't want it to be in a deeper fat because that will just waste the collagenesis. Fat doesn't raise anywhere really. So that's all 3 rows done here.
So other than bruising and inflammation, are there any other...
If you put it too superficially, the ends of the thread can cause inflammation in the epidermis. So sometimes you get a lump, which is why when you do the perioral region, for the top lip, it's okay to go this way. But for the bottom lip, I prefer to have only part of the needle here and go out that way because the mobility, even if it's in the skin, I have a feeling it just moves. It's the insertion. The insertion actually, the thread just moves after insertion. I've had it happen to myself before. You just see this lump in my chin for a few weeks before it resolves. It resolves fairly easily, but it's annoying for the patient, that's all. So we're trying to prevent problems.